chosen to speak about cervical cancer risk factor and prevention since January is the Cervical Cancer Awareness Month. Human papillomavirus (HPV) infection is the most important risk factor for cervical cancer. Other risk factors are becoming sexually active at younger age, having many sexual partners, having one partner who is considered high risk with HPV infection or who has many sexual partners. Other risk factors are smoking, having a weakened immune system such as HIV, long-term use of oral contraceptives, birth control pills, a diet low in fruits and vegetables, and having a family history of cervical cancer. Things to do to prevent cervical cancers are getting HPV vaccine. Vaccines are available that can help protect children and young adults against certain HPV infections. These vaccines only work to prevent HPV infection. They will not treat an infection that is already there. That is why, to be most effective, the HPV vaccines should be given before a person becomes exposed to HPV, such as through sexual activity. The vaccines require a series of injections, shots. Side effects are usually mild. The most common ones are short-term redness, swelling, and soreness at the injection site. We recommend HPV vaccination of children between the ages of 9 and 12. Children and young adults age 13 through 26 who have not been vaccinated or who haven't gotten all their doses should get the vaccine as soon as possible. Vaccination of young adults will not prevent as many cancers as vaccination of children and teens. We do not recommend HPV vaccination for persons older than 26 years. It's important to know that no vaccine provides complete protection against all cancer, so routine cervical cancer screening is still needed. Another one is to limit exposure to HPV. HPV is passed from one person to another during skin-to-skin contact with an infected area of the body. Although HPV can be spread during intercourse, but sex doesn't have to occur for the infection to spread. All that is needed is skin-to-skin contact with an area of the body infected with HPV. It is even possible for a genital infection to spread through hand-to-genital contact. Remember that someone can have HPV for years and still have no symptoms, so it's possible someone can have the virus and pass it on without knowing it. Using condoms, rubbers, provide some protection against HPV, but they don't completely prevent infection. One reason that condoms cannot protect completely is because they don't cover every possible HPV-infected area of the body. Since smoking is a risk factor for cervical cancer, not smoking is another important way to reduce this risk.